All right, I think we'll go ahead and get started. I want to welcome everybody. I'm hopeful that everybody can hear me on here. My name is Steve Hoover. I'm the owner and president of Wealth Partners Corporation over here in Overland Park, Kansas. I'm at the corner of Metcalf and College in the Darth Vader building. And I appreciate y'all showing up today. And let me kind of give you a real brief. This isn't going to be a long drawn out piece or webinar on Medicare. I'm going to hit some areas pretty quickly. Some of you are on Medicare, some of you are not on Medicare. So what I'm going to do is I'm going to kind of go through the basics, start with it. I always like to talk about that being the fundamentals, kind of going through. It may be redundant for some of you that are already on Medicare, but it may be something that you might find that you didn't know with that. So with that, I'm going to go ahead and share my screen with you, and let's go ahead and get started on this. And let's see here, we'll get that in and bring that up. And hopefully you will see that in a minute. And there we go. Let's go ahead and go from the current slide. And there we are. So with that, as I said, this is basically a Medicare 101 that we're going to be talking about. There is the disclosure I need to share with you before I move on. Let's move on and let's see what we're going to cover today. We're really going to cover a variety of things. We're going to cover the basics of Medicare. As I said, we want to kind of get back to the fundamentals, whether you're on Medicare or not on Medicare. We want to talk about the difference between supplements and Medicare Advantage plans, also about the issue with prescription drug plans, and also some important dates, because we're coming up on some important dates here pretty soon. So let's real briefly talk about what Medicare is, because Medicare is really broken down into essentially four parts, or three parts, if you will. You have what's called original Medicare, which is Medicare Part A and Part B. And Part A, most people understand that to be the hospitalization, some other areas. Part B is more going to the doctor, test, et cetera. And there is a premium that is involved with Part B. Part C is called Medicare Advantage, and I'll go into more detail on that later. And Part D is the prescription drug plan. So let's talk really what original Medicare covers. This is what they refer to as original Medicare. Part A is for hospital, skilled nursing, some hospice, and some home health care. Part A does not replace long-term care for skilled nursing or anything like that, but it basically is covering hospitalization for a certain amount of time. That doesn't cost you anything once you enroll in Medicare. That is covered. Then we have Medicare Part B. That again is for doctor's appointments, outpatient care, occupational therapies, et cetera. And in a minute, I'll go through of what Part B covers and for what cost there is associated with that as well. Then you have Part C. Again, that is what's called Medicare Advantage plans. And they call it Part C because everything in Part A and B is covered. The difference is they have your prescription drug inside that Part C, and there are some additional benefits, vision benefits, hearing benefits, some dental benefits, and some gym benefits that you're not going to get in what we call a supplement plan, which I'll go through here in a minute. And then we have Medicare Part D, which is essentially a standalone prescription drug plan as well. So let's see. Oh, sorry about that. I want to make sure if we need to admit somebody. Okay, hopefully everybody's in. Let's move on here. Now, let's talk about the options that you have when you reach Medicare. You're going to have original Medicare, which is Part A and B. Then you're going to have to make a decision of either doing a supplement for your Medicare, which is something I'll get to in a minute, but a supplement is basically another insurance plan. And you're going to have to get a prescription D standalone drug plan as well. Or you can opt for what's called a Medicare Advantage plan, which was the Medicare Part C. And a lot of times that covers drug, vision, dental, and hearing as well. But there are some distinct advantages between two of those, and I'll go through those in just a minute. But those are your basic options when you do hit the Medicare timeframe. So let's talk about this for a minute. Here's a monthly Medicare. This is original Medicare. As I said, Part A does not cost you anything to get into. However, in Part B, you do have an annual premium or a monthly premium of $148.50 a month. That is paid every single month, and typically it's taken out of your Social Security check. Now, if you do have a certain amount of income that exceeds, as you can see here, some of these thresholds, you will pay more per month for your Medicare Part B premium. The other part on the side is you do have a Medicare Part D premium as well that you will have to pay going forward. Now, understand the Medicare Part D program is coupled with the Medicare supplement plan. So if you do a supplement plan, you have Part A, Part B, a supplement, and Part D. It can get very confusing, but those are the four elements of a supplement Medicare strategy. If you have a Medicare Advantage strategy, you still have Part A, Part B, but Part D is included in all of that Medicare Advantage portion, but you don't have a premium that you're paying for the Advantage plan. And I'll go through some of the reasons why and some of the differences between the supplement and the Advantage plan, because you need to know about those differences. But basically, for most people, they're paying $148.50 a month. Some of my clients are paying a little more, but for the vast majority, pretty much everybody's paying the $148.50, and that will go up. They haven't given us the cost per month for next year, for 2022. That should be coming out here pretty soon. Expect it to be over $150 a month. Now, let's talk about what they cover. Part A covers basically your hospitalization is what it is, and you pay nothing for it. But there is a what they call a deductible. So in this case, if you were strictly on Medicare, original Medicare with no supplement, okay, I'm going to make that distinction, no supplement. You only have Part A. In a minute, you're going to have Part B. And you go into the hospital, you're going to have to pay $1,484. Now, you don't pay a premium for this coverage, but that's what you get. The other part is if you're in the hospital for an extended period of time, anywhere from 61 to 90 days, you pay $371 a day. 91 to 150, you pay $742 a day. And if you're in at over 150 days, you pay the full cost of going into the hospital. Now, if you have a skilled nursing, you pay nothing for the first 20 days. After the 20 days, for the next 21 to 100 days, you pay $185.50 a day. After that, you pay all of the cost of staying in a skilled nursing home. That's if you're on Part A. Part B, again, you have to pay a premium. You do have a deductible of $203 a year. Next year, it will be higher. They keep going up each year. And any cost for a doctor's visit, a test, or anything like that, Medicare pays 20% of that, or 80% of that, excuse me, and you're on the hook for 20%. That's if you just strictly took Part A and Part B and didn't get a supplement or an Advantage plan. That's what you would be looking at cost-wise. As I said, Medicare actually starts paying 80% after you hit the deductible. After you hit the deductible, they start paying 80%. So here's kind of an average, and this goes back to 2019 out-of-pocket costs. As you can see, the premium for Part B was $135.50 just 2 years ago, and it's gone up to $148.50. You have inpatient care, meaning you had to pay some money to go to the doctor. You had some drug costs, you had some dental service, and some other health care. So you paid about $654 a month for that. That's staying on original Medicare with no supplement or Advantage plan. Those would be your out-of-pocket cost. So let's talk about what the supplement does, because the supplement is another standalone policy that's issued by a variety of insurance companies. They cover the co-payments, co-insurance, and yearly deductibles of your original Medicare. So let me go through this real quick here. It's kind of confusing, but a supplement, when you get a supplement or a Medigap plan, you can choose either Plan A, Plan B, Plan D, Plan G, Plan K, Plan L, Plan M, Plan N. You can choose which plan you want. They're all guaranteed issue when you turn 65, but you pick which plan you want. And there's a corresponding premium per month for each of those plans. To make this simple, most people pick Plan G because Plan G covers everything with the exception of the Medicare Part B $203 deductible. Other than that, that plan will cover everything, all the cost of going to a doctor, test, et cetera. Because what a supplement plan does is it ends up covering the 20% that Medicare doesn't cover. The only part that it doesn't cover is the $203 deductible. Now we had, and that's basically, we would call that the Cadillac of plans, the Plan G. Prior to 2021, or 2020, excuse me, Plan F was the ultimate classic because Plan F, and I have some clients that are still on Plan F, it covers everything, and it also covers the $203 deductible. So you pay nothing out of pocket. But the issue is Plan F is significantly more expensive than Plan G. So I have taken people who are on Plan F and compared the premium to a Plan G plan, and they're paying well over $700 more a year to have Plan F just so they don't have to pay $203. So it doesn't make sense to pay $700 to save $200. So if you're in good shape, we can rewrite you from Plan F to a Plan G plan and lower your monthly cost of doing that. Because here's one of the things that a lot of people don't understand, even people on Medicare supplement plans. You can change your supplement plan anytime you want. There is no particular time frame. You can switch from Plan F to Plan G. Oh, by the way, Plan F is frozen. Nobody can get Plan F anymore. So that's, if you're in Plan F, you're in a frozen group. But somebody on Plan D can move to Plan G if they want. All they have to do is go through underwriting. And if they're in good health, they can do that. But I want to make one other distinction. When you first go on Medicare, when you're 65, it's guaranteed issue. So no matter what your health is and you get on a supplement plan, you are automatically and guaranteed to be issued that plan. The only time underwriting comes into place is if you want to change from one insurance company Plan G to another insurance company Plan G. You can do that as long as you're healthy. The other part is to understand that every plan has to cover exactly the same thing. So there is no difference between what is covered per the insurance companies. So in other words, Blue Cross and Blue Shield's Plan G and Cigna's Plan G cover the exact same services, exact same co-payments, everything. The only difference is price. So if we can lower your price, you're going to get the exact same services. You just may be a different insurance company. And I can run those comparisons for you. That's pretty easy to do for me, but it's something to understand. You're not locked in. You can change anytime you want, any time of the year. And we do that quite a bit to see if we can get a little bit better monthly cost on that. So let me give you an example here of two of the plans that really most people choose between, either Plan G or Plan N. And understand this about insurance. The more money you pay, the more benefits you're going to get. The least amount of premium you pay, you're going to have to pay something. And that's the case here with the difference between Plan G and Plan F, or excuse me, Plan N of the supplements. Plan G is going to cost you a little bit more, but you're not coming out of pocket with anything other than the $203. Plan N is going to be a little bit less per month. You're still going to have to come out of pocket with $203, but you're going to end up paying $20 every time you go to the doctor or $50 every time you go to an emergency room. So there is some additional out-of-pocket cost for you. But there is a price difference per month between a Plan G and a Plan N. And there is no right or wrong answer. It's dependent upon your budget and what you want to do. But that's kind of the differences on these supplement plans. So here again, this is what original Medicare covers. But if you get a supplement plan, this is what goes away. All of these expenses, all of these expenses go away. Your deductible for Part A goes away. Your 20% copay goes away. All the costs for skilled nursing and hospital copays all go away as long as you have a supplement plan. So let's talk about American Advantage plan, because this is what you probably see more often than not right now on TV, talking about Medicare being able to change and getting all these different benefits. A Medicare Advantage plan basically takes into account, they bring Medicare Part A and B. They bring in Part D as well. So it's an all-inclusive plan. It's issued by a different insurance, a standalone insurance company. Typically on these plans, you don't pay an additional premium to have an Advantage plan. You still have to pay your Medicare Part B cost. You still are required to pay that. But after that, you don't pay anything additional. However, you do have co-payments to go to the doctor. You do have a higher deductible. In some plans, you may have an out-of-pocket max of $3,500, maybe $4,000. But what you don't have is you don't have a monthly expense of paying a premium. Now understand, the Medicare Advantage plans also have kind of some limited facilities you can go to, and I'll get into that in a minute. Medicare Advantage works for some people. It doesn't work for everybody. And I'll kind of go through some differences here, and you have to determine which is best for you. So as I said, what Medicare Advantage does is it brings in Part A, Part B, and Part D all into one plan. Also, you get some dental, vision, and hearing benefits in most Medicare Advantage plans. So let's talk about the difference here, because you need to understand and be educated about the differences here. Medicare supplement plans, you do have to pay a monthly premium. Medicare Advantage plans, sometimes you don't have to pay a premium. If you do, some of them have a very low premium per month, but most of the ones I see don't have a premium. Part D is not included on a supplement plan, so you have to go out and purchase a separate Plan D or prescription drug plan. The Part D is included in almost every Medicare Advantage plan. All the ones that I've used do include a Part D, and it includes some dental and vision, and in some cases hearing benefits, along with some gym benefits as well. They call them silver sneakers. In a supplement plan, there is no co-payments to providers unless you take Plan N, but for typically if you take Plan G, you don't pay anything to go see the doctor. Medicare Advantage, you might have a $20 or $30 or $40 per visit cost. The out-of-pocket cost is pretty much zero on a supplement plan. The Advantage plans can go up to $10,000 of out-of-pocket. Typically, the ones that I'm using and seeing are about $3,500 to $4,000 a year would be the max out-of-pocket that you would have. But again, you don't have to pay that monthly premium as well. So there's some trade-off there. Can you appeal? Well, let me back up. Is there restricted for hospitals and doctors? For a supplement plan, here's the one issue. As long as a hospital, as long as a doctor takes Medicare, you can go to any doctor, any hospital, any place in the country and be covered. You don't have to worry. As long as they take Medicare, they will cover it. If you're on an Advantage plan, you have to stay within their network. And some networks are large, some networks are very small. So some may not cover a particular doctor's group, or hospital. So you need to understand and know what you're getting. And that is very important to understand going forward. Another part is, can you appeal a Medicare decision of not covering something? You can with a supplement, you cannot with an Advantage. The Advantage plan is in stone. If they say they're going to cover it, they'll cover it. If they say they're not, and there is no appeal process. Can the plan be dropped by your doctor, or can my plan drop? So in other words, your Cigna Plan G cannot drop your doctor out of the plan for a supplement, but Medicare Advantage, they can, and your doctor can drop out as well. That's why you want to make sure you understand exactly what Medicare Advantage plan you're getting each year. And I'll share with you in a little bit how we go about doing that. Can your plan be canceled? Medicare supplement, no. An Advantage plan, they could if they decided they wanted to cancel the plan. You would then be able to move to a different insurance company if that were to occur, but they can do that. And one of the other issues, you do have some travel issues with a Medicare Advantage plan. You might not be able to get care if you're traveling overseas or somewhere, somewhere in Canada or Central America, for example. Medicare supplement will cover up to 80% of that. So that is covered that way. So those are just some differences between the Advantage and supplement plan. The difference between a supplement and Medicare Advantage plan is really up to you. You have to decide what it fits your best, your needs and your budget as well. Part D, let's talk about that real quick. Part D, again, is a standalone drug program that's put out there. If you have Medicare Part A, Part B, and a supplement, you must get a standalone Part D plan. That's required. If you don't, there's a penalty for not doing it.
Hello, I'm the virtual assistant from Mary Henderson.
Sorry about that.
Hello.
Sorry about that. My phone rang and was going crazy there. But Part D is a standalone plan. You must have it. As I said, if not, you get a penalty for not having it. And I'll go through here exactly how it works as well. But the Plan D and an Advantage plan is included inside there. So as I said, you can do the standalone prescription drug plan. That's when you have a supplement plan. If you have a Medicare Advantage plan, they call it an MAPD plan. It just means that it's included in the Medicare Advantage plan. So let's talk about how this Plan D works. And basically, you have deductibles from $0 to $445. That means how much you have to pay out of pocket to have this. Then once you hit, and then there's some other costs that are involved. You're also paying a monthly premium for this as well. Then you pay, then from $445 to $4130, you're responsible for some other costs depending upon what they call the tier. Your drug is on, they tier them. Tier 1, Tier 2, Tier 3, and depending on what tier, they may be more expensive on one tier than the other tier. So you kind of have to look at each plan because each plan, by the way, is totally different. Every Plan D plan, every pharmacy that issues a Plan D charges more per drug, believe it or not, than others. So at CVS, they may charge X amount or more for your medication than a Walgreens will. So every year you can change those Plan Ds, and I'll go through how we do that in a minute, but let me kind of go back. Then you hit what's called, I think everybody's heard of what's called the donut hole, and that's kind of where you've hit, and you've taken a lot of medication, you've hit this area where from 4130 to 6550, you're on the hook for a lot more for your medication at that point. And that's called the donut hole. And then once you hit 6550, that's called the catastrophic coverage. So if you have that much in medical expense, you're talking, they're going to be covering a lot more. That's why they cover catastrophic. That means if you're taking that much medication, there are some serious issues and you're going to be covered a little bit more in your Plan D coverage. So really, you don't get much benefit out of these too much until you hit pretty much the catastrophic coverage. But it does help offset some of the cost if you don't have a prescription drug plan. So let's talk about enrollment, because this is some issues with what people are kind of confused about. When can you get into Medicare? And then some other dates of when can I change things. So basically, who's eligible for Medicare is when you turn 65, you're eligible for Part A and B, and you can still get either of them if you're still working. If you're working for a company that has less than 20 or less people, you are going to have to get Part A and Part B. Your plan will drop you at your work, and you will have to go on to Medicare Part A and Part B. Let me repeat that. You may not get dropped from your company plan, but you will have to take Part A and Part B. So you could have two insurance sides, Medicare and your company plan, even if you're still working. If you work for a company with 20 or more, you will not go on Part B. You will go on Part A, but you will not go on Part B. Then when you leave your company or your company ceases their company plan for you, you then can enroll in Part B. One of the things you have to understand is you have to let Medicare know if you're going to take Plan B or not. Because if you don't let them know, then there is a 10% penalty on your premium that goes on forever. It's a permanent penalty that they assess on your premium. And that can get very expensive as you go along each and every year, because your Medicare premium will go up each and every year. So let's also, one other part is if you are disabled, you can get Medicare as well if you're under 65, but you have to wait 2 years before you can get into that as well. So typically when you get into Medicare 65, again, if you're receiving Social Security, you will be automatically enrolled in Part A and B, and they will take your premium payment for Part B out of your Social Security. Initially, what you're going to do is if you're turning 65 this year, let's say 3 months before you turn 65, you're going to be eligible. The month you turn 65, you're eligible. The month after you turn 3 months after you turn 65, you're eligible to do it as well. So they give you quite a bit of time period to enroll in Part A and B, or excuse me, more importantly, Part B. So you want to make sure you get enrolled in Part B because you don't want to get hit with that penalty. Then they call the, as I said here a minute, they call the Medicare initial enrollment period 3 months before the month that you're 65 and 3 months after. Here are some very important dates coming up. From October 15th to December 7th, if you have a Plan D, Part D drug plan, you can start searching and investigating whether or not you should change that for the next year. So it always makes sense to check with somebody like me, or if you want to, you can go to medicare.gov and you can check who's going to have the drug plan that fits best for you cost-wise for 2022. I recommend everybody who has a Plan D plan to do this every single year because things change. Pharmacies change, what they're going to cover, the costs they're going to charge you, etc. And it's very easy. I can do it for you. You simply enter in medication you're taking, where you live, and it comes up with the best plans for you. And you can change, and it change starts January 1st of 2022. Also, if you're on a Medicare Advantage plan, that's when you get to change. You have the option to change from, let's say, an Aetna Medicare Advantage to a United Healthcare Advantage plan, because they have different benefits that appeal to you. Or your doctor moved from being in an Aetna plan and now they're in Humana's plan or United Healthcare plan. You can change in that time frame. There's no insured, you don't have to go through underwriting or anything. You can just change those plans, and on January 1st, you change to the new insurance company. Now, from January 1st to March 31st, they do give you a period of where you can disenroll, meaning let's say you enroll in the Humana Medicare Advantage plan, and in February, you find out that your doctor or your doctor's group left the Humana plan and went to Aetna. You have the ability to change back and go to Aetna's plan, but it's only in those first 3 months that you have it. So they do give you some dates to do that. It's the same with the Part D plan. You have the ability to make some changes with that as well. So you need to keep those dates in mind. We're coming up on that on the October 15th. You will start to see an awful lot of TV ads talking about Medicare Advantage plans. And what they're trying to do is get you to move from Aetna to, Humana, Blue Cross Blue Shield to United. So it always makes sense to check and see what's out there. You don't have to change, but it always makes sure that you're informed about what's out there and what doctors are in and what the co-payments are, what the deductibles are, and maybe some of the other benefits that they have as well. So I always encourage people to do that, and especially on the Part D drug plan. I want to address one other thing here on the supplements. I didn't do it on the supplements. As I said, there is no vision and dental benefits in those plans. You have to buy a standalone policy to cover vision and dental and hearing. They're very reasonably priced. And if you want any information on, just let me know and I'll get that to you. But they're very reasonably priced. But you have to do that. On an Advantage plan, as I said, they're usually included in the plan. So with that, I appreciate your time. I wanted to hit this for about 30 minutes. If you have any questions, you can reach me at 913-685-3207 or shoot me an email. I'll be happy to visit with you on any of this. It can kind of be confusing, I realize that, but I want to make sure that everybody has this information going forward as well. So with that, I'm going to go ahead and let you go. Unfortunately, I think one other individual wasn't able to get in. Don, I apologize for that. I will make available the recording of this. I did record it, so I'll shoot it back out to everybody. And but with that, I appreciate you taking your time today. Look for the recording of this so you can watch it again if you want, or if you just want to call me and ask me a question, I'll be happy to address any of your questions going forward. So with that, I appreciate your time, and have a great rest of the day. And I can see Mike's got his Chiefs helmet up there. The Chiefs better play better than they did this last Sunday, or I might have a real problem. You all have a great weekend, and thank you for your time.